a very, very important conversation. Now, this morning, Dr. Priscilla Van Dyke Say, consultant and family physician, head of Kolebu Polyclinic, and executive director of Global Outreach Consortium. She has joined me in the studio, and we're talking this morning about cervical cancer or cervical cancer. Which is it? Every time I don't know whether I'm right or wrong.
It's like tomatoes and tomatoes.
Tomato.
Any of them is fine.
Any of them is fine. So
Yes.
cervical cancer. Okay, so that is our conversation this morning. You're welcome to the zone.
Thank you, Natalia.
Okay, so January is a month dedicated to cervical cancer.
Yes. So
Okay.
globally, January is set aside to create awareness about cervical cancer.
Okay.
And the main reason is because it's one of the cancers that affects women gravely worldwide. And more importantly, those of us south of the Sahara, including Ghana. And to a very large extent, it's also been declared one of the preventable cancers. Because, most of the time, somebody may have like a breast cancer or even, let's say, a cancer of the stomach, and then it's difficult to pinpoint exactly what caused it.
Right.
But for cervical cancer, we know for sure what caused it, and it's the high-risk human papilloma virus.
Right.
So it's sort of like once you get rid of the virus, you can cure it in a way, or you can prevent it in a way. And so there's a lot of awareness creation so that people will be involved in trying to prevent the cancers from occurring to them.
Right,
Yes.
very interesting. Now, let's talk about how you can prevent yourself from getting the virus, human papilloma virus.
Yes.
How does one, stop themselves from getting there?
Okay. All right. So the human papilloma virus, we have different types. And most of them affect the skin, or what we call the mucosa membrane. So it's either your mouth, the genitals, and then also the skin in general. So there are over 200 types of the human papilloma virus. But out of these 200 types, we have those we call the high-risk human papilloma virus. And we call them high-risk because they've been associated with causing cancers.
Okay.
So they cause not only cervical cancer, they cause anal cancer, penile cancer, vulval cancer. But the cervical cancer is the one that is more or less, like, to a very large extent, clearly preventable. And you can prevent it because, one, if we have two main options. We have vaccines
Okay.
that protect against the high-risk human papilloma virus. So before you start sexual activity, which is one of the ways you contract the human papilloma virus, and you get exposed to the vaccine, it helps prevent you from coming down with the complicated effects of a viral infection in future.
Okay.
And so worldwide, countries in Europe, America have started vaccinating young girls to prevent them from the harmful effects of the human papilloma virus.
Okay.
And then even young boys,
Okay.
because it is sexually transmitted.
Right.
When you are able to reduce the virus within the population, it reduces the risk of transmission during sexual activity.
Right.
And the vaccines not only also protect against the human papilloma virus, some of the vaccines have incorporated the aspect which protects against genital warts,
Okay.
which is also a big problem, especially if women have genital warts and they deliver their babies vaginally. It can expose their children to the genital warts viruses. And then instead of the genital warts occurring outside of the body, it actually occurs within what we call the larynx or the trachea. It's what the babies will use to breathe.
Right.
And so just imagine somebody needs a clear pipe, and then you have these growths in there. It will make breathing difficult. And then the children will go to hospital. They remove these things they call papillomas, and then it grows back. And so that becomes a very bad quality of life for the child. So these vaccines protect against cervical cancer, and then not only cervical cancer, but other forms of cancers caused by the high-risk human papilloma virus, and then also the ones caused by the genital warts, that's HPV 6 and 11. So that's the first time through, the first way through vaccination.
Vaccination, okay.
And then the second way is
before you continue with the second way.
Okay.
You did say that advanced countries have started, doing the vaccination for young girls and young. When you say young girls,
you want to know
how young?
Okay. All right. So it's between an average of 11 to 15 years.
Okay.
Okay. But you can go as low as 9 years.
Okay.
And then you are eligible for the vaccine up to even age 26.
Okay.
And the caveat is that this vaccine is trying to prevent you from the harmful effects of a virus. So ideally, it should be given before sexual activity or commencement of sexual activity. Okay. And so once these vaccines are given to both boys and girls, there's something we call herd immunity. So it reduces the population of the human papilloma virus, the harmful ones, in the community.
Right.
Okay. So for those between 9 to 15 years, should they go for the vaccine, they get 2 doses. And then beyond 15 years, you have to get 3 doses to complete the regimen for the vaccination.
Right.
More studies are coming up, and some vaccines, we have Gardasil 9, which not only protects against 2 of the high-risk viruses, but an additional, I think an additional 5 as well. So it's like almost 100% that every kind of virus that is going to cause the cervical cancer protects against it. Some studies have shown you can give it up to age 45 years. But they'll always tell you your ability to protect yourself with the vaccine will not be the same as somebody who got it in their teens, but it's still protective.
It's still protective.
Yes.
Okay. But this does not happen in Ghana at the moment for young.
We don't have a national cervical cancer program, unlike what we have for the child welfare clinics, where once a baby is born, they go for weigh-in and then they get vaccinated, and it is part of government's paid program.
Right.
Unfortunately, we don't have anything like this currently.
Okay.
But the vaccines are available. At a cost.
So it's it's up to you to decide. Suppose you have a young, boy or girl, to decide whether or not you want to give them that jab. Okay. All right. Very interesting. So let's move on to number 2.
Number 2. Okay. So the fact is that we have what we call screening. So the idea of screening is to pick up abnormal cells early, so that you do something about it before it gets to a place where it is complicated, it is more expensive to treat, and it is even difficult to cure.
Right.
So the thing about the human papilloma virus is that when you get infected with it, you have about like 15 years to about 30 years where it's just sitting at your cervix, gradually causing changes, which is not a cancer. We call it a pre-cancer. Okay. So we are hoping that we are educating people so that within that 15 to 30 years that you tell yourself, I finished giving birth, I don't have any problem down there, you should go to hospital, have it checked, and assuming you have had a human papilloma virus infection, which is at a pre-cancerous stage, it will be picked up early. And it is relatively easier to treat. And the likelihood of cure is almost 100%.
Okay.
And the thing too is that even when you have been vaccinated, you still have to go ahead and screen. So it's not like you tell people to vaccinate and then they go to sleep. Everybody needs to start screening. And so depending on the country in which you find yourself, some people talk about screening from age 21 years, some talk about screening from age 25 years, and some talk about screening from age 30 years. And we have different ways we use to screen. And the whole idea is to try and pick any abnormality early. So we have a type of screening we call visual inspection with acetic acid. And today, for instance, the Medical Women Association of Ghana is launching cervical cancer awareness at the Tuesday market. And they are doing visual inspection with acetic acid for free to the market women and anybody at all. And so that is one type of screening. Then we also have what we call the pap smear. That's a little bit more technical. So for that one, when you present to the health facility, we will take a little sample from your cervix. It's an uncomfortable procedure. It's not painful. And then we just put a little of the sample onto what we call a slide, and then we send it to the lab for the pathologist to read and tell us whether they saw any abnormal cells or not. There's an advanced form of the pap smear called liquid-based cytology.
Okay.
So the liquid-based cytology is also picking up cells from there, but it's a bit more detailed than the pap smear. The good thing is that on the 30th of January, which is on Thursday at Kolebu Polyclinic, we've discounted the price of the pap smear for only 100 Ghana cedis instead of 170 Ghana cedis. So anybody can take advantage of it. So that's one example. Then we also have another type, which we call the HPV DNA screening, or PCR. You remember COVID when we were all doing PCRs?
Yes.
Exactly. So this PCR for the HPV is looking for the high-risk virus itself.
Okay.
And so when you screen for that, it will be able to tell you that you have HPV and this is the type you have, and the type you have is high risk.
Okay.
And so that will increase your likelihood of getting cervical cancer. And so you need some form of treatment. And all these screening, when something is picked up, we do follow up and then you get treated. And the whole idea is we want to create awareness so that people will screen. So let's say the VIA and the pap smear, when you go and do it and we don't find anything, we tell you to repeat it in 3 years' time. So that you do regular screening, and assuming there were going to be any changes, it will be picked up. But for the HPV DNA, it's sort of like picking up the virus. So when there's no virus, when we screen, then we tell you come back in 5 years' time. So depending on the method that you do, it will either be every 3 years or every 5 years.
Right.
Yes.
So typically when you do have a pap smear, you're supposed to repeat it 3 years later.
Yes.
3 years later.
Yes.
Right. And I know that for a lot of people who, because they are health conscious, and when it comes to sexually transmitted, whatever, they look out for certain particular things. But HPV is not necessarily one of the things a lot of people look out for.
Yes.
Which, unfortunately, is a big concern.
Yes, it is.
So what is it that we're doing as a society to let people know, to create more awareness and let people know how important that is?
Yeah, so I'm happy that you asked that question, and we are really grateful to Starr FM for joining us on this campaign to create awareness. We can't talk about it enough. At least for the past couple of years, like 5 years down the line, at least every January, we sort of make a lot of noise about it. We really kind of hope beyond January, there will still be a lot of noise about it. But importantly, I think we need to come together as a country and make a decision about the importance of cervical cancer. It's one of the few cancers which are preventable, okay? So assuming there was a program where every woman who reaches the age at which she needs to be screened, you get reminders, show up to the health facility, and the screening test is going to be paid for you. And there is some kind of a follow-up. And those who have abnormal cells are also followed up so that they don't get lost. And then later on, somebody has been picked up with a pre-cancer, nothing was done, and then a few years down the line, it's a full-blown cancer. So it's a conversation that starts with media personalities like yourself, which needs to keep on making noise about it, because there has to be some kind of political will to say that we want to bear the cost of screening for all eligible women.
Right.
So WHO, for instance, recommends that at the very least, every woman should screen 2 times in their lifetime, at the age of 35 and at the age of 45. So if a government wants to more or less embrace a kind of policy, they can build a policy around the WHO recommendations if they cannot afford to do it for everybody.
Yeah.
Exactly. So we just need to start from somewhere. And I think the non-communicable disease program of the Ghana Health Service is also doing their very best, and so many other civil society groups like the International Papillomavirus Society of Ghana, the chapter, they are also making a lot of noise. But beyond the awareness creation, we need to take more like concrete steps to make sure we have enough places for people to screen.
Okay.
We have enough pathologists to be able to make a diagnosis for people, and then we have enough places where when you identify a pre-cancer, you can easily treat.
Right.
So all those conversations need to be had, but we are making a lot of noise.
Okay.
And we hope that at some point in time, the political will be definitive. Yes.
Okay. All right. Now, I do know I've had conversations with a couple of people here and there, and sometimes they'll say that, oh, I mean, I've never, maybe you're looking at someone who's like 38, 40, 43, and they'll say, I've never had a pap smear. And for me, sometimes it feels quite alarming, you know. And so even here at this office, one of my colleagues, I've been taunting her. In fact, I said to her that I'll take her by hand to get it done at the same place where I do get it. But even up until now, she still hasn't had it. And this is a very learned person, you know, who knows everything there is to know. So, you know, it kind of raises a concern for me for a lot of people who may not even have an idea, you know, what's going on, and they are just living. You know what I mean? Are there any particular signs that will show should anyone be going through the pre-cancer stages? Is there anything in particular that you have noted over the years?
Okay, so most of the time, the pre-cancer stage, we have different levels.
Okay.
So if it is at a high grade level, then you are likely to show signs or symptoms which is similar to what might be for an actual cervical cancer.
Okay.
So symptoms like bleeding after sex, okay, or you've ended your period, you know you have a 30-day cycle, the 30 days is over, and then you've bled for 5 days and you don't expect to bleed again, and then suddenly 14 days after, it's not 30 days,
Right.
14 days after, you start bleeding again. So we call it intermenstrual bleeding. That is also a sign that you need to take seriously and get investigation about it. And then the other thing is also what we call a discharge. So the discharge will look bloody, or it might look like altered blood, which is not bright red but a bit brownish.
Right.
And in advanced stages of cervical cancer, the discharge can be very, very offensive in the way it smells.
Right.
So these are some of the ways that you can pick up, but to a large extent, it's very silent. Very, very silent. So, and you remember I told you, you can stay there for like 15 years with no problem, and then suddenly, boom, you just bleed, and then you go, and it's already a full-blown cancer.
Right.
So that's how come people need to screen regularly. I do appreciate that people do have some barriers, both educated and non-educated people, and one of it is the cost, one of it is the fear of what the result is going to tell me. But the good thing is, once, irrespective of what the result is, once it is picked up early, you didn't know you had it, or you didn't have symptoms before you went to do it, so that's good. So it means whatever they find is likely to be a low grade and something that can be treated.
Right.
So that is something to encourage you to go and find out, rather than wait for bleeding and maybe pain in your pelvis and that kind of thing, which most likely may be associated with almost a definitive cervical cancer.
Right.
So we want to, for all those who are afraid of what the outcome might be, right now you don't have any symptoms, so it's unlikely that you actually have it, but it's just to be cautious, so that you go do it, we tell you everything is fine, then you come back in 3 years' time or in 5 years' time, depending on the method that you use.
On the method. All right.
Yes.
You did mention cost. How expensive is this?
Okay, so the pap smear is 170 Ghana cedis at the
On a
moment.
regular, with
Yes.
no discount or nothing happening.
Yes.
Because you did say that on Thursday it's going for 100 seats.
Yes, only
Right.
100 Ghana
Okay.
cedis. Yes. Other facilities, it might be more
Okay.
because there are logistics involved. So depending on which logistics those other facilities may have to put in place before they get it to you, it might be as high as maybe 200, 250, 300. So it's variable.
Okay.
Yes. Then for the VIA, it tends to be relatively cheaper in terms of what is involved. We use salad vinegar, which is like we just apply it to the service and immediately I can tell you what the result is. So there isn't too much in it. So for that, we can easily do that for like 50 Ghana cedis.
Okay.
Then for the liquid-based cytology, you can have anything between 200 to 300 depending on where you go.
Okay.
And then the one which is like the PCR test, it starts from 400
Okay.
upwards,
Okay.
depending on which facility that you go.
All right.
Yes.
Very, very interesting. All right, so we're going to say thank you, Dr. Priscilla Van Dyke.
Thank you so much
for
for
coming through. And on Thursday, I'll try and see if I can get my colleague to come on Thursday.
Yes, or any other
any other.
Yes,
Yeah.
it won't be a problem
It won't
at
be
all.
a problem.
Yes,
Thank
and
you
then
so much.
maybe I should say this
Okay.
for those who are shy of coming and undressing. We have a method we call self-testing. So that is the PCR. So they teach you how to do it, and then you sample yourself.
Right.
So you don't have any third party involved. You sample yourself, you send it, and then they do a PCR test for you. So for
Right.
those who are shy, they can opt for that. It's a bit
Right.
more expensive, but then I
Okay.
hope that will
But
encourage
the thing
them to
about
do.
women is that, at some point somebody is going to see all of you. You know what I mean?
Yes.
Because you're going to have a baby at some point.
Yeah.
If you want to do a family planning method or getting an IUD,
Yeah.
if you're doing a pap smear, at some point.
Yeah.
So you just have to brace yourself for it.
Yes.
Because it will happen
Yeah.
at one point or another.
Yes.
So I
Thank
think
you so much for
yes.
having us and creating awareness about cervical
Right.
cancer.
Should anyone want to reach out to you directly? Is that possible?
Yes, it's
Okay,
possible.
how do they do that?
All right, so I'm going to be a little unconventional. You can reach me on 0. Okay, I'll text you the number. It's supposed to be like a Momo number because I don't want to give my personal number out. But
Right.
that number is also very active.
Okay.
Okay, so I'll send it to you immediately, and you can put it on air. Anybody who wants to come can. And
Or may have questions.
Yes, definitely. But we are also on several social media pages. We are doing the Bisayen campaign. So
Okay.
we are on several social media pages. We are on LinkedIn, we are on Instagram, we are on Facebook, we are on X as well. So you can post your questions over there.
Okay.
And then just before I leave, first we're doing 100 for 100 women. But now we have somebody who also came on board to sponsor, so we can sponsor up to 200 women at only 100 Ghana cedis. So people should take advantage of it. Thank you so much. I'll leave the number.
Yes, please.
Thank you.
All right, so there you had it. Cervical cancer is quite the conversation to have. It's very important that as a woman, you screen. If nothing at all, go and get a pap smear and repeat it every 3 years so that if there's anything, it will be detected early and then you can have cure for it. This is The Zone. My name is Natalia. Do stay tuned.
She sparks up your mid-mornings. It's The Zone.